So today we'll be talking about the location, as well as the size, shape, and weight of the heart. When most people think about the heart, they simply imagine it sitting somewhere on the left side of the chest. But the truth is a little more interesting than that. The heart is actually located in the thoracic cavity, which is the chest region of the body. More precisely, it sits in a special space called the mediastinum. Think of the mediastinum as the central compartment between the two lungs, almost like a protected room where the heart is kept safe. Now, although many people say the heart is on the left side, it is not completely on the left. The heart actually sits almost in the center of the chest, but slightly tilted toward the left. About 2/3 of the heart lies to the left side, while 1/3 remains on the right. This slight shift to the left is the reason why, when you place your hand on your chest, the heartbeat feels stronger on the left side. If we look at its position more carefully, the heart lies behind the sternum, which is the breastbone you can feel at the center of your chest. At the same time, it lies in front of the spine, meaning it is protected both in front and behind. On both sides, the lungs surround it, and the ribs form a strong protective cage around the chest. All of these structures work together to protect the heart from injury. There is also a very important point on the chest where the tip of the heart touches closest to the chest wall. This tip is called the apex of the heart, and it is found at the fifth intercostal space along the left midclavicular line. In simpler terms, this is the area slightly below the left nipple line in adults. This location is extremely important in nursing and clinical practice. It is where we feel something called the point of maximal impulse, PMI, the place where the heartbeat can be felt most clearly. When nurses examine a patient, they place their fingers at this point to feel how strong the heartbeat is and whether it is regular or irregular. Understanding the heart's location is also very important when using a stethoscope. Each heart valve produces sounds that are best heard in specific areas of the chest. So when you see healthcare workers moving the stethoscope to different spots on the chest, it is not random. Each position has a purpose. Even in emergencies, this knowledge becomes life-saving. During cardiopulmonary resuscitation, ACPR, chest compressions are given directly over the sternum. This presses the heart between the sternum and the spine. The heart helps pump blood to the brain and other organs when it stops beating. Finally, the heart is not just sitting loosely inside the chest. It is enclosed inside a protective covering called the pericardium. This covering helps hold the heart in place and prevents it from moving too much during breathing or body movement. And when you really think about it, this positioning of the heart is not accidental. It is carefully designed to protect one of the most important organs in the body.